So I'm going to talk about pneumonia in beef calves. So I'm working in Mississippi now. The picture I got here is Nebraska, and a lot of the data that I'm going to talk to you about comes from herds in Nebraska, but the problem seems to be widespread, and I'll talk a little bit more about that as we move along. I also think that the problem of pneumonia in calves prior to weaning, so we're not talking about calves that have moved on into a stocker operation, that haven't gone through the transportation stresses, the commingling, all of the things that we associate with stockers or feeder cattle and their problems with respiratory disease. These are calves that are out on green grass and sunshine with their moms. And so understanding why these calves get sick gives us a little bit more of a fundamental understanding of why calves get pneumonia in the first place. All right, so this is an emerging diseases committee, and so we ought to talk about whether or not this issue is an emerging disease or not. And it'd be nice if I could give you some data that showed you clearly that this is an increasing problem, and I can't. I don't have that kind of data, and actually if anybody does, I'd be happy to see it. But my perception is that it's becoming an increasing problem. When I talk to veterinarians that are working with these herds, they think it's an emerging problem, that it's something that they didn't see to the degree that they do today. So if you think about where emerging diseases come from, there's a number of ways that we might think of a disease as emerging. One of those is that things about the system, right? There's an emergence of a novel agent, right? So something that has gained a new set of virulence factors or something, like we think about E. coli 0157. It had gathered up these new tools and became a new pathogen somewhere in the course of time and emerged in our cattle populations. It might be that it's a pathogen that existed someplace else and now we find it here in the United States. West Nile virus or PED, for example, something that has suddenly shown up. There may be it's an emergence of an agent that we previously thought we had controlled and now it's not controlled again. Maybe bovine tuberculosis is an example of that. It may be that our host population has suddenly become susceptible for some reason, maybe because of genetic selections. We've created an animal that's more susceptible to those types of infections. And probably more commonly than we think, it might be because our production systems have allowed a pathogen to flourish because we've created a setup of a system that provides a niche for that organism. Now there may also be, so those are biological reasons why you might have a pathogen arrive as an emerging pathogen. There may be some other social things, just increased awareness. So for example, that we've mitigated a disease of greater impact. That might be the case with summer pneumonia. A lot of ranchers that I worked with, that the original problem was calf scours. Oh, that's helpful, thank you. Yeah, it is cute. I'm going to turn this around maybe so that I can look at everybody and see my slides at the same time. All right, is that better maybe? Probably blocking everybody's view now. So it might be increased awareness that we've gotten rid of this bigger problem, and now we have the next issue to pay attention to. So when I was working with ranchers with calf scours, and as we worked and tried to solve those problems, then when I became aware of this issue of respiratory diseases, they said, well, now we need to do something about these calves that have respiratory disease. So their primary concern was scours. When that was resolved, there was something else to address. And then there's just the social interest. So once we start talking about a disease, the media picks it up and other people are talking about it. And so some emerging diseases are really issues of social awareness. And I think this bovine respiratory disease in weaned calves there might be a number of these things that might explain why people are talking about this particular issue now. So here's the challenge. We've got this young calf that's out with its mom, and suddenly it's gotten sick. The ranchers recognize that it's sick, and so there's a whole lot of things that are going on inside that calf that we need to be worried about? What's that host pathogen interaction that's taking place in the calf? What infected it? What's going on in there? But I'm an epidemiologist, and so I'm thinking about the broader population. So not just what happened to this particular calf, but what happened around it in its environment that may have influenced that infection, right? So are there other calves that are also undergoing that same thing? Who was the source of this pathogen? What about the production system allowed that pathogen to flourish? So bovine respiratory disease is a big deal. It's it is the leading cause of sickness and death in cattle. It's hugely expensive to the industry overall. It has a huge impact on the economic well-being of our cattle, but we most often think about it in terms of causing disease in beef cattle after weaning and once they're in other production systems. I have been trying to come up with some estimates about the cost of pre-weaning pneumonia, and so we can debate these numbers if you want to. But of the 29 million beef cow inventory, about 85% of those cows have a calf that's born alive. About 0.6% of those calves are going to die from BRD in terms of excess mortality. So that's about $100 million of losses just from dead calves. There's about a similar, almost $100 million of losses in terms of calves that get sick and require treatment, lose weight, so they're lighter at weaning and so forth. So just a general estimate might be that this disease costs about $200 million to U.S. cattle producers every year. So we've been working on this problem for a number of years. Amelia Woolhams wrote a paper from a survey that we conducted. We did this survey in 3 eastern states and 3 plains states. And we asked producers just various questions about their experience in the year, the calf crop immediately previously. And they reported that they had seen respiratory disease in at least one of their calves in about 21% of their operations. So about 1 in 5 operations said, yes, I've had that problem in my last calf crop. So I want to point out a few of the findings. One is that finding BRD in calves in the herds was associated with large herd size. So if they said that they found BRD, they were more likely to be a larger herd. When we ask about cumulative incidence of BRD, well, that tended to be associated with smaller herds. And so that seems immediately like we've got this mixed bag of information here. But if you think about it, larger herds, they've got more calves, there's more of an opportunity to see at least one calf that's sick, right? So this is a kind of a skewed population. So it's easier to find that sick calf in a large herd. But if you talk about the seriousness of it, so how many calves are sick, then that tended to be associated with smaller herds, smaller denominator, right? So even those few calves are divided by a smaller number of calves. Anyways, we also noticed that the incidence of BRD was associated with calving during the winter, introducing calves from an outside source, offering supplemental feed to calves, and use of an estrus synchronization program for cows. Now, how can you explain that? So some of these things, calving during the winter, all right, so weather stresses and things like that might make sense. Introducing calves from an outside source, all right, well, we brought in some new pathogens and maybe made some calves get sick. What about offering supplemental feed to calves? So what they're talking about is creep feeding calves. Is creep feeding calves? Yeah, right. So it's not the creep feed, it's that it's a system. The system allows the calves to get together and have more effective contacts. So it's just simply a management, it's the production system that facilitates that. What about estrus synchronization for the cows? Same idea, right? So you got to bring those cows in, you got to sort off the calves, you're going to gather those up, they're probably going to be bunched up in a group for a few days while AI is going on, and then he turned back. So maybe there's some additional stresses from being separated from their moms, and they're all commingled and tightly bunched. Again, the production system, not necessarily that AI causes pneumonia. All right, we asked veterinarians. We did a similar survey in those states of veterinarians asking what they thought about it. And actually, the veterinarians said, well, we think about 18% of our herds had BRD last year. So that was really close to the 20% number that we had from the cow-calf producers. So that was good. And they had some ideas about things that they thought might be associated with it. So again, weather came up, inadequate colostrum consumption, introducing new cattle, not using vaccines, calf diarrhea, various nutritional deficiencies, BVD PIs, calving in confinement. So they had these different management practices that they suggested might increase the risk. All these management practices are what we would consider component causes. I want to be an epidemiologist for a second and just explain what I mean by component causes. This is a way of thinking about diseases where for any given illness, there might be a series of things that in combination make the calf sick, right? So they don't get sick until all the full combination is there. So it's like completing the pie. So in my example here, Mannheimia hemolytica might be the thing that's the bacterial infection that really causes the pneumonia, but maybe you also have to have a viral infection and maybe some kind of a weather stress, and maybe there's some other things that we don't know about, genetic factors and so forth. When you fill that pie, when they're all there, you have a sick calf. All right, good. So now imagine that you've got a world where Mannheimia hemolytica is always there. That's not hard to imagine because pretty much it is always there, right? And BVD virus is always there, right? So that's another one that's it's always circulating there. In that population, in that world, when it gets cold or when it gets dusty, calves are going to get sick, right? So in that setting, people are going to look at the situation and they're going to say, when it gets cold or when it gets dusty, I get sick calves. It's the weather that causes sick calves, right? That's what the veterinarians were saying. In another world where it's Mannheimia hemolytica is present and it's cold, but BVD is not always there, the relationship would look like when BVD shows up, we have sick calves. BVD causes pneumonia, right? And so that's a challenge for us when we're doing these field studies because we never know what sufficient cause was the last thing. So it's why we see all these various relationships and we don't always see them consistently. It's a really important point. Okay, and so just to finish this idea, this is the reason why we have endemic stability. So endemic stability is the condition that mostly exists with our animal populations. That is, the infections are out there, the pathogens are there, but we don't often see illness until something completes that component cause. That one last thing that needs to be there, whether that's the weather stress or the addition of some additional pathogen or something like that. So once you add that new thing. So we see that with respiratory disease. We see it with salmonella. It may be that the thing is actually the loss of protection, loss of immunity. So it's the reason why calves get sick with calf scours when they're 2 weeks of age, 10 days to 2 weeks of age. They've lost the antibody protection in their gut. All right, so we kind of pulled that away. All right, so think about that we may be having some exposure to various environmental factors, various pathogens, or some change in our immune status. And these things change over time, right? There's all kinds of things that are going on in livestock production systems that moderate these opportunities for exposure, the opportunities for the various stresses and immunity. And so that's really the deal that we're faced with is what's going on with immunity over time and what's going on with exposure over time. And we've got some studies. I would really like to know what that graph really looks like. So in the course of calves on ranches over time. What's the pathogen load out there, and where's that coming from, and what's their immune status look like over the course of time? So I'm going to say just a very few things about the exposures, because I don't know very much about the exposures, and then we'll spend a little bit more time thinking about the immunity. Okay, so what about these agents? We have looked, and I can tell you that it's not hard to find all the bacterial pathogens in these ranches, so they're all there. They're opportunists. The Mannheimias, Pasteurellas, Histophilus, we find them there in these herds, and we usually find more than one if we look. So they're there. Viral pathogens, it's a little less clear about. One particular virus pathogen that we've got a lot of interest in right now because it seems like it shows up a little more than by chance is bovine coronavirus. It's all anecdotal. Don't write that down because I don't know whether it's the thing or not, but we're kind of interested in it because some of the herds that we've investigated, well, an awful lot of calves are shedding bovine coronavirus at that point in time. We've looked at BBD. I mentioned BBD earlier, and so we've done some whole herd testing in some of these herds that are having problems. We've also done some whole herd testing in comparable control herds. Well, so we found BBD virus in 1 of 5 herds. All right, so that herd that might have been the issue in that herd, but it's not a consistent problem in the herd. So we can't blame this all on a virus like BBD virus. And that's all I know about agents. Well, let's spend a little bit of time thinking about the immune response of these calves and what's going on over the course of these young calves' lives. So they've gotten antibodies from colostrum, we hope, and that's providing them some protection, but we know that wanes with time. With time, they're going to get an active immune response, and so that's going to protect them for the longer term. If we really put some values to that, and assuming that the half-life of the antibodies that they absorb is about 16 days, then whatever they started with in terms of maternal antibodies, whatever that value was, by the time those calves are about 90 days of age or so, they're almost all gone. Okay? And so now I am going to put some numbers to it. So if we think about various titer levels, well, it's important. I'm going to use this. So it's important how much antibodies they got when they were born, because the calf that got shorted on colostrum, it's going to be low sooner and might get sick at a younger age, right? So those antibodies are important. But even if they got high levels of antibodies, they're still mostly gone by the time those calves are 90 days of age. One of the strategies that we use to protect calves is to vaccinate the dam prior to calving. And you could see that you could have some influence here. You could have some influence making sure that the calves bond and nurse and get that first dose of colostrum. And you can protect calves in that first 60 days of age. But you can imagine that, regardless of the vaccination strategy or whatever you did to increase the titer of antibodies from colostrum, they're gone by the time those calves are 3 to 4 months of age, right? So while it has a big impact in the first 60 days, maternal antibodies' influence on protection against disease is certainly gone by 3 or 4 months of age. All right, well, eventually those calves have this active immune response. It starts off as a relatively inefficient process, and by the time the calf is 5 to 8 months of age, they're prepared. So I want to show you a little bit of what that might look like. This is some work that was done at Oklahoma State. So this is a group of researchers that looked at antibody titers to various viral pathogens. They vaccinated. Their research was to vaccinate at an early age, 67 days, and then booster it at 190, versus what might be a more typical pre-weaning vaccination at 167 days and repeating it at weaning at 190 days. So an early vaccination protocol and a late vaccination protocol compared to the green line, which is no vaccination. So what you can see here is we start off with high antibody titers. They decrease with time, right? And regardless of whether they got vaccinated early or whether they got vaccinated late, that response is occurring late out here at 6 months of age or so, right? So there's a hole in the middle, regardless of the time, the age of the calves were vaccinated. What I'm showing you is for IBR, but everything that they looked at looked the same way. So antibody titers high, maternal antibodies decline in all viruses, with the response not really occurring until the calves are about 6 months of age. Right? That might make you think that regardless of the virus, this period of time here between 100 and 150 days is an age of susceptibility. And so if we look at data, so this is data from steers. These are steers that completed the feedlot, but we're looking at them prior to weaning. And right, so they're the highest incidence. This is 15,000 steers over 14 years. The highest incidence of disease is in that 3 to 4 month old calf. Right, lower before that. Why? Probably because of maternal antibodies. Lower after that. Why? Probably because of this active immune response that eventually gets started. All right, here are some actual outbreaks from some ranches here in Nebraska. So this is a 300 cow herd with 87 pneumonia cases. So that's 29% of their calves had pneumonia, and the ages, right? So they all started getting sick starting at 110 days of age or so, and ending by the time they're 6 months of age. Here's another one. So 19% cumulative incidence. Few calves that were less than 2 weeks of age. Most of the calves getting sick sometime after 100 days of age. This is what I call the exception that proves the rule. This is a different ranch. They didn't really complain about their respiratory disease, but they had some, and we had 4 years of data. So this is a summary of 4 years of data. Most of their problems occurred prior to 60 days of age. And then they didn't have very much trouble until calves were, again, 4 months of age or so.
How do you explain that?
How do I explain? What do I think? I think they have a so right, this is a group that those calves are getting sick at a young age. I'm going to explain this in a second, but this is a good place to do it. This is a group of calves that probably aren't getting colostrum, right? And I'll give you a better answer in a second. All right, you're starting to get the picture. Here's another one, and I've got a lot more outbreak data. I thought by the time I showed you 4 of them, you get the idea. These calves are getting sick when they're 3 or 4 months of age, pretty consistently, right? And it's really regardless of when they're being born. Okay, so now here's data from the Meat Animal Research Center here in Nebraska. They've got data from 110,000 calves over 20 years, and they said, you know, this is like that pattern that I showed you from the one ranch, right? So they had an incidence here early on, and then a greater incidence once those calves get about 100 days of age or so. And they said, here's what we see. There's a big increase in the incidence from 0 to 20 days of age, and then again at 70 to 100 days of age. And somebody ought to do some epidemiological studies of these phases to understand what management practices might decrease BRD incidence. And so that's what we're doing, and that's what we're thinking about. What's going on here? These calves are probably the ones that didn't get all their colostrum. And these are the guys that are now getting into that age of susceptibility, and they're doing that all at the same time. And so I'll make a point about that in a second. They said the greater incidence between 75 and 170 days of age may be partially attributed to increased commingling of animals during breeding season when cows were frequently gathered for AI. So they point to the AI thing as the thing that initiated it. I think that, well, all right, that was one of those opportunities to gather calves and do some commingling, but we also have this really susceptible age group. that you're doing that to. All right. Herd immunity is when we've got some protection, and the majority of the majority of the population is protected, and that keeps the pathogen from spreading. So if most of you guys guys and gals are immune, and I introduce a pathogen over here, it doesn't get through the room because most of you aren't going to transmit it, right? When you take that away, then suddenly the pathogen can move through. So herd immunity is an important concept. We vaccinate to try to achieve some level of herd immunity. It's what our measles programs are based on in children and so forth. So here's what that might look like. This is some data from Amelia Willems. And so they looked at serum titers. This is against respiratory syncytial virus. And so they looked at titers when the calves were 2 days of age. That's what they acquired from maternal antibodies. And then later on as the calves got older. So Dr. Willems says that a titer of 1 to 16 or 1 to 32 is probably protective. So something less than that is probably a susceptible calf. So we'll draw a line there. When those calves were 2 days of age, most of the population was protected. By the time those calves were 56 days of age, actually the majority of the calves were below that line, and by the time they're 117 days, they're almost all below the line, right? So now we've got a population that's susceptible. If you throw the pathogen in here, maybe nothing happens. But if you throw the pathogen in here, and maybe it spreads. So my analogy in where I live in Mississippi is if I go out in my front yard in May and I toss a match in the grass, nothing happens. Grass is green, match goes out. And I can do that in June, and I might be able to get away with that in July, but in August, if I throw that match out there, I'm going to have a grass fire, right? Don't do this in Nebraska, any of you guys that live in Nebraska. But that's the idea, right? There was protection. It didn't matter. The pathogen doesn't have any traction, but when the group is suddenly all susceptible, they get sick. All right, so let's look at that. These are the same ranches that I showed you a little bit ago. Now I'm going to show you based on the time. So these are the dates when calves were sick. This is an epidemic curve. These lines here represent the proportion of calves that are between 100 days and 120 days of age. So they're starting to move into that window where they're no longer protected by their maternal antibodies. And so as we have more and more calves that are now in that susceptible phase, then suddenly we have an outbreak, right? Here's the next one, right? So large proportion of susceptible calves, and we have an outbreak. Large proportion of susceptible calves, and we have an outbreak. All right, so that goes back to this idea that we've got this susceptible population, and when they're all moving in phase by age, because we've got a tight calving season, we lose this herd immunity all at once, and calves get sick. All right, so let me just go through. I want to point out that incidence in this data set by year shows you that the incidence of BRD varies quite a bit by year, so there are other factors besides just this age phenomenon. Other things are contributing to whether calves get sick or not. You can imagine, so this is data from the Meat Animal Research Center, looking at their 20 years of data, and you can imagine that maybe the thing that's happened is they had their outbreak and there was some protection afforded by that gradually the herd lost its immunity over time. See this declining, and then when herd immunity was low enough, they had a break again, right? So the whole herd has lost they haven't been being challenged by this virus, the cows aren't producing colostrum antibodies and so forth, and then we have another outbreak. That's just a theory, and it's something that we're interested in exploring.
Any vaccine populations that we're talking about?
These would all these ranches that we're talking about would be ranches that have had a history of having a problem. That's how I got called, and they would have been using a pretty solid vaccination program. Yeah, it's a good question. This is just to show you that, so this is the ranch incidence for the data that I showed you earlier from those 14 herds. Sometimes the ranch incidence is higher. In this section here, there were more calves sick on the ranch than in the feedlot. And so sometimes that happened, and more often there was more sickness in the feedlot. So, but sometimes you can have outbreaks in the calves that are more serious than what you'd experience as they move into the feedlot. And if you look at the calf's risk, so those calves that are sick, we identified that they were sick as calves. Are they at more risk when they get into the feedlot, or are they at less risk when they get into the feedlot? Well, the answer is it seems like it depends, because some years, if the risk was greater, so knowing that they were sick on the ranch, we knew that they were more likely to get sick. Those calves were more likely to get sick in the feedlot, and some years they were less likely to. And overall, the average is even. So it doesn't seem like it's a general predictor. You can't say calves that get sick on the ranch are more likely to get sick in the feedlot. It depends. And maybe for some factors that we don't understand yet. This is interesting. So over 4 ranches and about 5,000 calf records, bulls were more likely to have respiratory disease on the ranch than heifers and steers fell in the middle. So there's some kind of a gender effect. Well, this is something that's recognized in people as well. You know, there's if you're in an injury, if you're in an automobile accident and you go to the hospital, or any kind of a traumatic reason for being in the hospital, males are more likely to get pneumonia in the hospital than females are. So it's just an interesting phenomenon. I'm not sure how we can use that information yet. Also, this shouldn't be a surprise to anybody. If your mother was a 2-year-old heifer, you're more at risk for respiratory disease than if your dam is a 3-year-old or older, right? So it probably has to do with all those risk factors associated with whether calves get colostrum or not. Okay, so summarizing all of this, there are some calf-level characteristics that put calves at risk for BRD. Age of the dam, right? So whether or not she got that calf up and got it nursed, and whether she had dystocia or the quality and quantity of colostrum that she may have had. Gender of the calf might affect BRD risk. Then there are these herd-level characteristics that I think maybe are the more important message here. There are 2 patterns of occurrence of BRD. We see BRD sporadically in young calves. So that's the rancher that goes out and finds those few calves in the first 60 days that he treats for respiratory disease. I suspect that those are calves with failure passive transfer. We've got a study going on right now where we might be able to answer that question. And then we have these much larger and more sudden outbreaks of pneumonia in older calves that are 3 to 4 months of age. So we think that the younger calves are failure passive transfer, and we think that these sudden outbreaks are really the loss of herd immunity when calves are at a susceptible age. And so this lack of herd immunity is probably play an important role in all of this. We've got studies going on now where we're trying to work in so is there a way that we can intervene with vaccines and try to get some immunity at an earlier age? And that's a bit of a challenge for the reasons that I showed you earlier. All right, let me say thanks for your attention, and I've got a number of people that I've worked with on this project that I want to acknowledge. We also had some money from Zoetis to do some of this work that I want to acknowledge.